Joining us today is Biotechnologist Lorena Diblasi. We invite to that. Earlier on this morning, we were having a detailed conversation with her during our radio broadcast because the authorities at CONICET have essentially reached the formal decision to proceed with her dismissal from the institution. We have actually had the wonderful opportunity to speak with Lorena Diblasi on quite a few different occasions now, and we previously did so on the other radio station. With Lorena and with several others from the team, about the study on administered vaccines and the potential adverse effects on human health during COVID-19. How are you? Good evening.
Good evening, Pancho. Thank you for this space.
I always told you that wherever I was, the microphones would be open to you because I knew what you were doing. And I knew about the research you were carrying out. To be honest, I was surprised when they told me that you'd been separated and left, unemployed by CONICET. Is this already confirmed?
The reality of the situation is this. Last year, they started formal disciplinary proceedings against us for this work we presented, which we actually submitted to CONICET, specifically requesting their assistance, right? So that they, as a scientific institution, would somehow repeat these studies and validate them as official findings. That's what we've been asking for, and it's been requested in various criminal cases. So last year, when they started the proceedings, they called us to testify, which was honestly very unpleasant. The trick questions, the investigator, Mariana Fernandez, acting practically like a judge, and she still maintains that stance. And well, after that, we had no more news until Friday, the 27th of February, when they closed the proceedings. And in that time, between September and February, they called Gabriel Lutti and Pablo Yunes to testify, who are the ones who did the analyses in Cordoba, right? Because we paid for a service. This must be clear. We didn't do it as part of CONIC. It was done in a CONICET institute, but it's work I did within the scope of my private life. That's why, the proceedings have no reason to exist, right?
In other words, did you use anything from CONICET to do this?
We paid for a service, just like you could pay for it.
But you paid CONICET.
Exactly, to the ICITAC Institute in Cordoba, where that equipment is, because that ICP, mass equipment, isn't just anywhere. Right. They're expensive, highly sensitive, highly complex machines, and we paid for the service with contributions from the community. We didn't use any resources from CONIC either. I work at CONICET, but I did this as an independent investigation, like everything we've been doing, because it's not the first study, it's the fourth study.
So in this particular case, you were with several other collaborators of yours as well?
Exactly, with Dr. Marcela Sangorrín and with Dr. Martín Monteverde, a physician, and Dr. David Nonis, a cellular and molecular biologist.
Right then, and who actually conducted the studies on the vaccine?
The staff in charge of the team. For example, if I'm in charge of a team, you send me samples, I'm the one responsible, the one who gives you the results, everything.
Right.
Now, they called these people to testify. I've also been reading misstatements. All the questions were very loaded, you see, and they called my director and Marcela's director to testify. Well, and what's the conclusion? That they're closing the investigation, but they want to dismiss me.
Exclusively you?
Of course, because Dr. Sangorrín has already had a retirement approved. So they can't, let's say, dismiss her, if you will.
Or sue you. Let me ask you a question before we go on. This equipment we're seeing on screen right now, next to you, what is that equipment?
Yes, this equipment, Veritatas 1000, right? It's equipment developed by the engineer Juan Jose Sinali from Rosario, who's an Argentine eminence, a truly capable person.
Also from CONICET?
No. Engineer Sinali is someone who has over 100 developments. There were many more individuals who collaborated closely with the Argentine army.
And what is that equipment for?
And he developed this equipment now in record time because when we were at the Argentine National Congress, which I attended, I showed the case of Jose Daniel Fabian, this gentleman who had a 2-kilo weight sticking to his chest.
Oh, yes.
Well, it's to show one of the effects that vaccines, anesthetics, and serums are leaving us with, right? Because last week I went to evaluate this in Buenos Aires with around 40 patients. I was publicly shamed on the front pages of every newspaper in Argentina. I also initiated several complaints and legal notices against Infobay, Página 12, and Jorge Riel.
As if you were what exactly?
They ridiculed and mocked it. They mocked exactly what is taking place right now.
Of the investigation?
Of course, of showing Jose Daniel Fabian with this adherence he shows to different ferromagnetic and non-ferromagnetic metals. This equipment measures the magnetic field, and we reached the conclusion that there isn't a magnetic field. It's not a magnetic field. What this person is emitting, or the various people who exhibit this phenomenon.
Well, there have been people here admitted to rehab for a long time as a result of a virus that they say might be from the vaccines.
Well, there are many. Look, when I did before the Congress, I presented this at the Congress when we started listing the reported harm in people who have civil or criminal lawsuits, administrative claims. I found more than 90, so the table had, let's say, 90 columns. Thrombosis, tinnitus, loss of vision, diabetes, a variety of different syndromes, and significant difficulty with walking. It's a lot, let's say. And the thing is, the Ministry of Health doesn't show it, Pancho.
So, what did you find in the vaccine?
We found graphene oxide. That study was done in front of a notary public, yes, through optical microscopy coupled with fluorescence. And in all the brands, we found this same material, which has a characteristic fluorescence, yes.
And what exactly does that material result in? For humans?
It's toxic to the human cell. The cell can't metabolize it, and it crosses the blood-brain barrier.
Right. And what can it cause?
And it can cause you, for example, the famous thrombosis. The thing is, the material isn't alone. That's why the research continues. Electron microscopy studies were done. Here in Argentina, 2 studies. One here in General Roca and another at the University of La Plata. That was repeated in Spain, in Canada, in Romania, in England. In England and in Spain, through micro-Raman, they detected graphene oxide. But what happens? Those particles, which are nano and microparticles, because they have different sizes, contain copper, palladium, yttrium, technetium, dysprosium, europium inside. So why do we do the ICP mass spectrometry? To quantify these chemical elements that we were finding inside those particles. So you can't evaluate the toxicity of copper because copper isn't free in the vaccine, it's inside those particles. And I'm tired of explaining this. You have to evaluate the toxicity of the particles.
In other words, let's see, boron, chromium, arsenic, gallium, aluminium, mercury, heavy metals and metalloids that make no sense in living beings.
Exactly, like the lanthanides. Like dysprosium and europium. And we started finding these elements. We said, what is this used for? And there we saw they're used to make quantum dots, for example.
I see.
There's undisclosed technology here.
Did the labs make themselves available to you or not?
No. And they were. I have the email sent to Pfizer, AstraZeneca, or one of them.
According to those who've investigated with you, one of the critical points was the initial refusal of the pharmaceutical companies to reveal their formula's composition.
Exactly.
Is that actually correct? Following 3 court rulings or more, primarily within the United States, labs like Pfizer and AstraZeneca have officially acknowledged the specific elements present in their vaccine. However, these vaccines are still being given in Argentina despite what was discovered. Is it the only country where these vaccines are still being given?
No, there are other countries too, yes. Yes, in Latin America. They're still being given. The thing is, of course, people don't want to take these substances anymore, and they also want to blame us for that. But listen, if you had a thrombosis, if after the vaccine, like the case of Graciela Suarez, she has to sleep with an earthing cable because she, being a dog groomer, scissors started sticking to her hand and she started having discharges in her body. And well, you're not going to want to get another injection because it's common sense. And the thing is, they've also been analysed, we analysed Cadenga, the flu one, in front of a notary public twice, here in Neuquén, in San Luis, and there's fluorescent material, and no declared component is fluorescent. And the Cadenga case is blatant, because in the diluent solution, where they declare water and sodium chloride, Takeda Lab from Japan, and which ANMAT approves here without any quality control, that liquid is full of fluorescent material. And we did this, 3 biotechnologists here in Newtown.
The flu vaccine?
As well.
Oh, as well.
We also analysed it in front of a notary public twice. That's why there's an alarm, Pancho. That's why we also approached CONICET.
But to be perfectly honest, we are frequently receiving official health notices indicating that you really ought to get the flu vaccine. And even more so in my particular case, to give you a specific example, as I have a medical history of a variety of different health conditions.
Right, and we also have them handing over the glaciers. This is all, as I say, all. These evils come from the same father. They're children of the same father, you know. There's a whole issue behind this.
But this is something you actually started doing as soon as the COVID pandemic had finally passed. You immediately started with these detailed studies.
In 2020, I'd already appeared twice, for instance, here at the Plotier Deliberative Council, warning about the vaccines, because they were already announcing this. It was already known they wouldn't be any good and weren't what they claimed. In 2021 in Spain, studies started being carried out in Argentina too. I presented everything in 2021, in December, here at the National Ministry of Health. That day, then later a week afterwards, there were more than 400 people there. But here there was a lot of censorship of information. It promised us a public debate, but it didn't happen.
Who offered you public debate?
Matthias Nayera, who was the director of primary healthcare.
Here in Neuquén?
Yes, that's also recorded when I'm talking to him. And back in those days, there hadn't been particularly many studies yet, so we were discussing the details of this spike protein and how, in the end, the messenger RNA wasn't actually there, that well-known one we all heard about. In the end, there's something else in there. Because in Korea, when they start looking at the samples, they test it against semen.
I mean, look, this is very serious. We're telling,
Exactly.
encouraging people to get vaccinated, and the data's clearly showing this. Are you anti-vax?
It's a term they use to disparage us. That's it. They used it for the first time in May 2020 in Germany, when 1 million people took to the streets. They started calling them anti-vaxxers, all sorts. At this point, yes. I'm not going to be pro-vax if I'm fear. I'm not going to inject my children with something when I don't know what's in it, when I see it has fluorescent material.
Now, but look here, I do not understand this. There are situations that can arise, especially with children, who need to have, I don't know, something against chicken pox, something against various
Let's weigh up the risk and benefit.
Yes.
Chickenpox. I had it as a child. Nobody dies of chickenpox, and now they're designing vaccines for every single illness.
The combined triple vaccine for measles, mumps, and rubella. Does it also have these problems?
Exactly, that's the point. That the combined studies of all the researchers in the world, as we manage to get samples and analyze them, we keep finding the same thing. That's the problem.
This morning on the radio.
You know what I say, Pancho?
Yes.
Let's call a halt. Hey, let's call a halt. Yes, at a national level. Let's have official analyses if they don't trust where we get the samples from, or if they think we're lying. Well, because it's not just the studies, there are people who've been harmed. And there are children who died.
Yes, I see.
Children died.
My God, I don't know of any children who died. I do know people who had their problems, people who were inpatients for 6 months in rehab, in clinics here in Waco. Now that, I must say, is something I definitely do know about.
A case of Amber in Tucumán, the 3-year-old girl, the vaccine, and within hours, she dies. And there are loads of cases like that of sudden death in children. Here in Rio Negro, there's also a teenager who was given the vaccine, and he started bleeding. That poor boy bled to death. He was an athlete, a rugby player. I mean, they were healthy people, that's my point. So if you're healthy, an athlete, you get the vaccine.
Now, is it the vaccine's fault?
But if you're a healthy athlete, they inject me with something and I die, what else could be to blame? Well, then let's do the analyses that...
These specific items are absolutely required. Now look, just listen to me for a moment. What I'm saying is that there are people watching us today. After the radio interview where we announced we'd be with you tonight, we had a great many people asking us how they could watch. That is right. What I mean is, at one point you said there are vaccines that aren't authorized, that are from an Indian lab, and they're giving them to newborns.
Exactly. The brand isn't even registered in Argentina, but that's now going to a criminal case.
And this criminal case is against the Ministry of Health?
Of course.
Now, I don't understand.
There are many cases. There's a mega case as well.
And what's in that mega case?
And in that mega case, Dr. Julio Rezona is suing all the labs, the media outlets, all the, let's say, entities that carried out this plan, if you will. Because this was a plan of fear to terrify the population, the lockdown. Through fear, they managed to execute this. That was the common denominator.
Actually, I was broadcasting from my own home for roughly about a year.
Right, I was teaching virtual classes too, and the students didn't get together. Lots of issues here. Did suicides go up? Yes. Depression increased.
What would the solution be?
First, I say we have to call a halt. An official analysis must be carried out, and public officials like Gaston Moran, who is charged in our case and continues, let's say, holding a public office at the INANMA. Enough. Let's do the proper analyses. Let's show them. Let's look after the population first of all. Then there are loads of abandoned people, those same disabled people, yes, who nowadays are being neglected by the state as well. Many are consequences of the vaccines, many disabled people. And the people were left abandoned. We help a lot of people to get by on a medical level and on an emotional level too, which is really important. So, taking responsibility for all this damage, let the cases move forward. Let the judges and prosecutors move forward with whatever they have to. That's the first thing that needs to be done.
Well, you are still currently working. You have been officially removed from CONICET, but you do have another job, do you not?
They want to make me redundant, to let me go. They're closing the investigation and they're telling me that. Well, we now have 10 days to present the defense. We're going to present it, obviously. Because all of this is really inconsistent. I, of course, have already started something else on an independent personal level because I don't wish to be part of an institution either, where the truth is being covered up. As scientists, we're supposed to work, and that's what the Code of Ethics says, which they claim we violated. Quite the opposite. The Code of Ethics says that when faced with a problem in society, you have to act, which is what we did. Outside of CONICET, but it's what we did as researchers, because they don't want me to call myself a researcher. I am a researcher because I research.
Let's see. Another reason they're removing you is because they say you've misrepresented your qualifications.
Now, in the investigation, they say that I call myself a doctor. No, many people call me doctor. It's not my fault. So they say, and it really does make me laugh, that I don't correct anyone who calls me doctor. So it's as if I'm deliberately presenting something that is entirely false, or at least that is what people often like to say these days. Researchers. But I am an independent researcher. The thing is that at CONICET, within the categories, you have researcher, support staff. I am professional support staff. And I always clarify it, and I have clarified it, as I have always clarified that I did this independently. So the logic they use is, oh, this is false, therefore the studies are false. No, excuse me, what are you saying? They grab onto anything to dismiss the studies.
Why is this not more widely known to the public? Why does it not appear as breaking news stories on the mainstream television channels, in the daily newspapers, and everywhere else?
Because all of this comes from Zionism. That is why I talk about the glacier. It all comes from the same hand. The handover of water to Makora, it all comes from the same hand. So until people tie all the loose ends together and join all the causes, do you see what I mean?
Let's see, wait a minute. I had it written down here. I'll tell you now. Are the different laboratories, like Pfizer or AstraZeneca, linked to what you call Zionism?
That is why at the World Economic Forum, they'd already been announcing it. That is why they organised Event 201, or 21, in October 2019, where they simulate all of this. So many people are unaware of that information. That is why it's important to be informed and understand why they were changing the laws for us. Through the laws, they can execute this whole plan.
When you started with all of this, there was a government.
Yes.
And the government changes. Did the rules of the game change for you?
Everything remains the same. Malay is now still buying vaccines from Pfizer, the ones they rejected in the United States. He invested $72 million. What for? So it is the same. They said they were leaving the WHO. It is not real, because the PAO, which depends on the WHO,
Yes.
continues, let's say, buying vaccines in Argentina. And it is a supranational body. So what we have to do here is, through our health authority, which is INAMN, carry out these analyses. Why is there no desire to do it? What is being hidden? Why did they not perform quality control on any vial? Not a single one.
What exactly do they say to you when you ask for quality control to be carried out?
That they verify against the certificate of analysis of origin. That certificate of analysis of origin, and I was told this in Mar del Plata, it is recorded in the hearing of court number 4 in the year 22. They verify against the COA, the certificate of analysis of origin. The COA has been requested in case 12096/2023, in which I am the complainant, with the legal representation of Marcelo Seufer, a lawyer, and where many injured people have come forward with batches analysed by us. What did Judge Capuchetti do? She blocked the lawyer's access. That went to the appeals court. Meanwhile, time passes and people continue to get injected.
Why? Is the lawyer not from here?
No, it's all in Buenos Aires at Comodoro Pio.
No, but you say she blocked his access.
She blocks his access to the system for no reason at all. What for? To make us waste time. When this goes to the appeals court and 3 judges take it on, the judges say, "No, madam, there are people affected here by the batches that the researchers analysed." And then it goes back.
Is there someone in the judiciary who ruled in your favour?
Exactly, these judges did. Yes. In fact, Judge Ochoa in Cordoba, in another case, he's trying to get all the information, but they're blocking him too.
And here in Argentina, there's no information. There's no information on this beyond what you've studied.
In what sense?
Or what you've thoroughly investigated, information on the specific chemical content of the vaccines, all of this, the absolute only bit of information there is what you've carried out.
Us and Dr. Luis Marcelo Martinez, a geneticist.
Well, that is precisely the reason why your working group, they are currently the only studies there are in Argentina.
That's why there's the other study by Luis Marcelo Martinez, Marcelo Witt, Gustavo Fano, which was done at the University of La Plata, and we got similar results. That was done in 2021. It was prior. Dr. Monteverde, also in Santa Fe with Liz Femia and Lisandro Lasserre, who are biotechnologists as well, they also analysed 50 vials, and the same thing was found in all of them.
How did you actually go about obtaining all those vaccines in order to carry out your analysis on them later on?
They were donated to us by doctors and nurses, that's the truth. Afterwards, if they want to say that we purposely added something inside, that they were contaminated, well, they can say whatever they want. But before saying that, let's make an official request through a prosecutor to seize the samples that are in the vaccination centres, because the ones for legal safekeeping aren't there, unfortunately. They're not there. The Ministry of Health didn't take charge of ensuring the samples.
Tell me, have you already had a chance to speak with the provincial health authorities about this?
I've told everyone. I grew tired of sending Andrea Pebin notes as she never appeared. I've kept them all here for her.
Have you spoken with Reguero, the current minister?
No, I've had enough, because you see, I've knocked on every door, from the National General Audit Office, the Deliberative Council, MPs, legislators, the Ministry of Health. That's it. I even went to schools. My work is done now, I think, and, well, now it's up to the public. To react, isn't it?
Nah, that's fine. I mean, I'm faced with a very particular issue. I'm faced with it firstly as a long-term resident of the city, and secondly as a professional communicator. I mean, looking back at what you've been doing, I've actually been talking with you for several years now, and it's been mainly with Dr. Sangorrín during that whole period of time. But now this has reached a turning point, let's say. One researcher retires and the other one gets the sack.
Yes, exactly.
I mean, and what are we left with? The private sector?
Well, that's why. Thank you for this space, so we can speak out.
No, but we wanted. We were curious.
Of course, the impunity is very serious. The CONICET board, because it's not like all of CONICET, no. I mean, it's the board that's making this decision. And there's clearly something set up, because Guillermo Duran, who's the one reporting us, he reports us with that word. But he was also asking for the trials to be repeated. No one listened to that part. A mathematician with the other chemists, Echenique and Lesiana, they were all the ones showing the rising infection curves in 2020. That's where the conflict of interest lies. They were promoting the PCR tests, all of that. I mean, these same people, that's why. It's not that everyone is corrupt. These same people who have conflicts of interest because they were, let's say, also receiving subsidies to present papers saying the vaccines are safe and effective.
Yes.
But then what's happening to us as human beings, I ask? Where are the real researchers? Because a researcher has to investigate with the evidence on the table.
Well, Lorena, it's always a pleasure talking to you.
Likewise.
Regardless of all the things one goes through, at the end of the day, right?
Yes. Yes, I understand. I understand.
You can well imagine that this is not exactly a simple matter for us to deal with.
Besides, they say I'm spreading terror. No, I'm not spreading terror.
Well, that's the point. But in any case, having said that, I really think somebody in a position of authority has to listen at some point and make a firm decision. Right, let's do the proper analyses to prove that what they're saying is actually completely incorrect.
Of course.
Or let's do the analyses, and if we're wrong, that is quite another matter.
Exactly.
Thank you for coming.
Thank you very much.
No, thank you very much, really. Greet Dr. Sangorrín when you see her.
Right, will do.
We've been talking with the expert biotechnologist, as not everyone actually calls her a professional doctor, Lorena Diblasi, herself. She was suspended. And on the verge of being dismissed from CONICET for her studies, focusing primarily on the vaccines administered and the potential adverse effects on the health of individuals during COVID-19.
Empower translations. Translations for all humanity.